we got speakers and stuff on here, right, for the sound to play?
Yes.
Okay, so when I ask them if they want to unmute to answer questions.
Yes.
Perfect. Good. Okay, so for those of you who are joining us online, you are welcome to unmute yourself when I ask questions. But before we get started with today's presentation, for those online and on the room, again, my name is Joe. I'm kind of like Cher, if you think about it. You don't really know what Cher's last name is, nor will you really know mine. Just ask for Joe. That's all you need to know. There's only one Joe in Illinois and here in Whiteside County, and that would be me. So the first question I'm going to ask, though, on understanding Alzheimer's and dementia is, if I was to come into this room right now, and for those of you joining on Zoom, and say, I have cancer, knock on wood, I don't. But if I said that, what's the first question you're going to ask me? So I'm going to start off with the room first and see what they say. So what would you all say?
What kind?
So the room says what kind? Would anybody else say anything else online? Feel free to unmute if you'd like. We got basically all nods here saying the same thing. So why do we say what kind for cancer? But when somebody says I have dementia, we don't say what kind. Because there's over 70 forms of dementia. This guy that's on the screen, and no, we're not talking about me because I am a big guy. We're talking about Alzheimer's. Alzheimer's disease accounts for 60 to 80% of all worldwide cases. It's just, this is the big kahuna. Now, remember, Parkinson's is a dementia. Lewy bodies is a dementia. These are all things you need to remember that, again, there's tons of forms of dementia. So when somebody just says, they're just losing their memory, it's just dementia. You need to really ask, what kind of dementia is it? Why? Because there's such a misconception about dementia. They just assume by saying it's dementia, it's nothing. Remember this disease, and I'm not trying to be the bearer of bad news, but this disease is lethal. It's going to kill the person. And this disease, the brain basically forgets how to eat. It forgets how to sleep. It forgets how to breathe. Now, that's in the late stages. Again, the very late stage of this disease. But this is a disease you need to know about because, again, there's no cure right now. We have trials going on. Hopefully, one day we're going to find a cure. But this is a disease that people really need to know about because it's more than just forgetting, people's names. It's more than just forgetting things. As this disease progresses, the long-term memory goes last, short-term memory goes first. All right, so we're going to go ahead and we're going to get started. I'm going to be skipping through some slides today just because this is the 30-minute version. But by the end of today, we're going to compare Alzheimer's and dementia. We're going to recognize how this disease affects the brain. We're going to list some risk factors. We're also going to identify the stages because we talk about it in 3 stages. We're going to talk about current FDA recognized approval treatments, and then we're going to name some resources that you as nurses, as social workers can utilize to help your clients and really increase CGH's bedside manner even higher than what it already is. All right, so let's start off by testing your knowledge. So we're not going to have you answer, live, but we are going to test your knowledge. So the first question I'm going to ask is approximately how many Americans are currently living with Alzheimer's disease? Is it 3 million? Is it more than 6 million, 8 million, or 11 million? So think about it. What do you think it could be? We're going to go ahead and we're going to kind of hover over. And let's see, the answer is actually more than 6 million Americans are currently living with this disease. Again, that's not worldwide. That's just in the United States that are living with this disease. So let's test your knowledge again. All right, about how many unpaid American caregivers are taking care of people living with Alzheimer's or another dementia? 8 million, over 11 million, over 14 million, or more than 18 million. So again, think about it real quick. How many is it? And the answer is, I know you all thought it was 18 million, but it's actually over 11 million unpaid. Imagine that. You're nurses. You're paid for this. Imagine doing this 24/7. My mom is actually dealing with this right now with my aunt, who was just diagnosed last week with late stage Alzheimer's. And she even said to me, she says, Joe, she says, I didn't believe you last year. When you said that this disease will be worse than caring for your 2 grandmothers with late stage cancer. And she says, it most absolutely is. In fact, I'm going in next week to give her a week of respite because she needs to get away. This is a disease that these caregivers go through constantly, of constant questions, the same questions. So it is really hard on these unpaid Americans taking care of their loved ones. All right, so let's go ahead and let's watch a video. The sound hopefully will work in here. We'll see in a minute. So let's know the facts. Okay, so on here it talks about help us share the facts, because again, we want to break down the stereotypes and the misconceptions that this disease actually has. And we do have a chat that came in, so I just want to check it real quick. Oh, it says no sound. Oh, we apologize on that. You did share sound, right? Oh, no, you didn't. That's why there was no sound. I got it. Okay, there we go. Sure. Okay, sorry about that. We had it. The sound was just the music, but now it's working. So thank you very much for letting us know that. Okay, so in there too, it talks about we're leading the way. For those of you who don't know, the Alzheimer's Association, we are a nonprofit. We're going to talk about resources again, but we are the third largest funder of Alzheimer's research and help in the world. And I know you're thinking, well, why would you share your number 3? Well, the reason why I share that is if you take out the 2 big funders, the US and Chinese governments, we are the largest private funder of Alzheimer's research and funding in the world to end this disease. So really, I mean, that's still to be proud of. Number 3 behind 2 of the largest governments in the world. So just wanted you to be aware of that. All right, so Alzheimer's and dementia, we're going to test your knowledge again. You're like, oh, geez, I didn't realize I was going to school. That's why I said I feel like a professor up here. All right, so let's go ahead and let's test your knowledge again. So question number 1, true or false? Alzheimer's is a normal part of the aging process. True or false? What do y'all think out there? We're hearing a lot of falses here, and that is absolutely true. It is false. This is not, with a big N-O-T, not a normal part of the aging process. Because if it was, every single one of you on this call, every single one of you in this room, you would all know somebody, besides from those you work with personally, that has this. Remember that when a senior passes away, 1 in 3, not 2 and 3, not 3 and 3, 1 in 3 seniors will pass away with some form of dementia. So again, not a normal part of the aging process. All right, now let's go ahead and let's ask the next question here. And this question again is true or false? People younger than age 65 get Alzheimer's disease. We have a lot of truths in here, and that is absolutely true. There's actually more than 200,000 Americans living with this disease today. My cousin at the age of 50 is one of those living with Alzheimer's disease. So again, people can get this younger than 65, but again, it is something that can happen before then. All right, so let's go ahead and let's listen to one of our experts talk about the disease.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
And that's why you want to ask what type of dementia and really figure out what it is. because each dementia is going to have certain drugs that can be used to help with the symptoms. There might be certain therapies. We want to know what type of dementia it is to make sure it's treated or we're caring for them properly. And for those of you on the call and in this room, how many of you have ever heard of Robin Williams? Okay, everybody, what did he die of? So we're hearing the word depression, suicide. If any of you have Peacock, now this is not part of the curriculum, but I do like to share it. If any of you have Peacock or YouTube, look up Robin's Wish. It is a documentary done by his wife. It's about an hour and a half long, and it talks about the story of Robin Williams because everybody just assumes he committed suicide. He actually died of Lewy body dementia. He was misdiagnosed. So he had one of the worst cases. So if you want to learn more on that dementia, I recommend that video. Just me personally recommend it. It's very well done, but it will give you a new perspective in a different type of dementia and what it actually does. So I do recommend that. Now on here, I'm just going to give you again a quick glimpse of some of the other big dementias that you're going to see. And one here, number 4, Down syndrome and Alzheimer's. This is actually a special program we're going to be doing hopefully in January. I'm personally working on it with Advocate Hospital in Chicago, where we're going to be talking about how Alzheimer's affects those with Down syndrome earlier. So again, as you can see, there's quite a bit of other dementias, which is why we want to get in the habit to teach people what type of dementia do you have and get people to really think about it. Okay, so let's go ahead and we're going to now skip forward and look at how it affects the brain. So we're going to go ahead and listen to one of our experts.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Okay, so again, this goes just a quick recap on the disease. Again, it was discovered over 100 years ago. And remember that, you know, Alzheimer's causes these nerve cells to die. And think about these nerve cells. There's these neurons in the brain, right? And there's over 100 billion of them in the brain. And each of these neurons, they have up to 7,000 touch points. So as they die, look at how many you're losing. You know, you're losing a lot. And so Alzheimer's disease causes those nerve cells to die. And again, it decreases the memory, thinking, and behavior, which we're going to talk about in a later class for how do we communicate and work with those living with this disease. All right, so let's go ahead here to our next section on the risk factors of Alzheimer's disease. So let's go ahead and test your knowledge yet again. This is now going to ask, what is the greatest risk factor when it comes to Alzheimer's disease? Is it genetics, family history, or age? What do you think? Genetics, family history, or age? Genetics. Now, this is kind of a trick question because all of these are risk factors, but age is the greatest risk factor to Alzheimer's disease. After 65, your chances increase, and after 85, it increases by 34%. So age is the greatest of the risk factors, and we're going to watch a video now that's going to explain a little bit more, and specifically about the deterministic and the risk genes.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are 2 categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Now, again, when she talks about those two genes, the deterministic gene basically is your mom had it, your dad had it. Your mom's mom and dad had it. Your dad's mom and dad, like literally everybody gets it. That's why it's extremely rare. But the risk gene is your mom had it, your mom's mom had it. So it may increase the risk of you getting it if you don't change certain behaviors, which again are, you can look at the Lancet study and others, or our healthy living class that kind of talks about it a little bit. Again, there's no way to, to cure this disease, but there are a continuing research on what can be done to possibly change some of those risk factors. So again, as we take these classes, you'll learn a little more. Now, again, populations at higher risk, Hispanics are 2.5 times more likely than those who are white to develop this disease. African Americans are about twice as likely to develop this disease. And almost 2/3 of Americans with Alzheimer's disease are women. Now, are the women because you live longer than men on average? Possibly, but there are other studies going on of how certain foods interact with the chromosomes. So there's a lot of research still going on with a lot of these factors to continuing to find out why this stuff is happening. Okay, so let me go ahead and skip through this now. All right, now we're going to take a look at the stages of the disease. So I'm going to go ahead and play a video with two people. The first one is losing the words, because this gentleman you're about to listen to, he was a reporter for his entire life, and now he's struggling with the words.
Math, I can't do a simple tip anymore. I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
So as you saw there, he forgot what he was going to say, had to rethink. He's in the earlier stages of the disease, but shows you kind of a little bit about how, again, even people, we know some people who are doctors that get this disease. You're like, but they were a surgeon for all their life. Again, this disease, affects can affect everybody. So again, it's not just, certain factors. All right, so on here, it talks about Alzheimer's disease is a continuum. And I know I got like 3 minutes, so I'm going to try to get through as much as I can here as quickly as I can. But it starts off again, this goes to show this disease starts 20 years before it shows its ugly face. And these are the stages that you start to see it. Again, there's no symptoms, but the biology is happening. We don't know. Goes into, again, MCI starting to become a really big thing looked at, which is, again, mild cognitive impairment. And so is that Alzheimer's? Is it other dementias? What's going on with it? So that's kind of the early stage and being able to start to see. But then once diagnosed, you have dementia due to Alzheimer's disease, which causes mild, moderate, or severe, also known as the early, middle, and late stages. So in the mild stages, again, everything's fine. They can do everything on their own, no major issues. But as they get into the moderate stage, that's where you're starting to see, again, they're forgetting things. They may start to say, Nancy, bring me that thing that we put the food on, that circle thing. They have to start describing what it is that they're going for. And then in the severe stages, which is where my aunt is, she'll eat, but her mind doesn't tell her to chew. And if my mom says chew, it doesn't matter. She can't process what chew is. And so this is where, again, it starts to, forget how to operate. So these are your main diseases or main stages. Now, as we take a look again, the next thing we're going to talk about is FDA approved treatments. So on this screen, you're going to see again how it started with the discovery of the disease. It wasn't until 96 that we started to see some of these drugs, and I'm not going to even try to pronounce them because I can't. but you can see them on your screen and you can see the progression. It's taking us a while to get there, but we're starting to see since the latest Educatimab, also known as Aduhelm. You know, do we approve the price of Aduhelm? No, we do not. But we do like that this was the first FDA approved drug in, as you can tell, basically since 2014, to be approved, that at least is moving us in the direction to hopefully one day find that cure, because this drug in the early stages, you know, shows that it has the ability to possibly slow the progression of the disease. But again, it is one of hopefully many drugs to come that are in the pipeline in phase 2 and 3 trials. So if you want to learn more, I recommend taking our Advancing the Science course, where they go in more detail on the science and what's coming. Okay, so the next thing we're going to skip through here is going to talk about trial match. So let me skip through real fast. So this is something I want you all to know about. This is called trial match because this may help some of your clients, some of your patients. And this is a program that's free of charge that you can sign up for, that's going to tell you if there are any trials in your area for someone living with the disease, somebody at risk. I am actually on trial match because do I have dementia? No, but as a guy in my late 30s, I am 2.5 times more likely to get dementia by the time I turn 60 because I am obese. And we do know that if you are larger in middle life, it increases your risk of getting the disease. So I'm working on losing my weight, but I'm part of trial match in case a trial ever shows up that I can participate in to, again, find a way to stop this disease. So let me play this that talks about trial match.
By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So again, this is something that you can participate in. Doctors can recommend. We are working again with the hospital on a lot of these. So we'll get you more materials on that as we go. Okay, so lastly is resources that you can use for yourself and for your clients. The first is our 24/7 helpline. It is called the helpline for a reason, because you can call day or night 24/7 and you will immediately be able to talk to our team on my patient started to do ABC and I don't know how to respond. They can actually guide you on how to respond with your patient. You can call if all of a sudden you're hearing a patient say, my mom is talking in a native language, Polish, Spanish, and she hasn't talked like that since she was a little girl, because in this disease, they're going to progress back. You can call the helpline and they'll be able to help because they have the ability to translate over 200 languages. So language is not a barrier. Also, it's a crisis line. I had a woman call me after 45 years of marriage. 1 a.m, her husband woke up and said, "Who are you?" Didn't recognize it was his wife and went to leave the house. She called the helpline. They guided her through how to talk her husband back into bed. So again, it is going to be a great resource for you. Our website, of course, is another great resource. And then our alz.org/CRF, which is our community resource finder, is also great because it will help you discover what local resources are available, from support groups to education programs. It is basically our version of Google. So I highly recommend that one as well. And then just so you all know on the call, call the local senior center because they actually have grants and things too. Now, they're not the Alzheimer's Association, but they have some state grants that may help your clients from covering medicine costs to transportation. But if you call the Whiteside County Senior Center, they'll be able to fill you in more because they're one of the the hosts through the Area on Aging to handle the grants. So I do want to mention that since we have nurses on the call. Again, that's just for you to know to help your clients on a local side, but you can always call our helpline as well and they can get you that information. All right, with that being said, we're 3 minutes after. Do we have any questions in the room or any questions from those on the screen about Alzheimer's disease? We'll see if anybody puts chats in, anything from the room while we wait for chats.
When you talked about Alzheimer's and Down syndrome, are you only looking at Down syndrome or are you looking at other developmental disabilities?
Well, so that one was up because there is those with Down syndrome. Again, I don't know all the research yet on this because it's something I'm working on due to a request that came in from a local agency, which is why we're putting the program together. But we do know that those with Down syndrome tend to form this disease in their 30s. So just because of what Down syndrome does to their progression on top of then Alzheimer's disease. So that's why you saw it up there, because it's more prone with those with Down syndrome. But the science behind it, I'm not sure on. But again, it's just one of the many different forms of dementia that are caused in correlation with different lifestyle factors or different factors that we have genetically. So. Oh, let's see. Can I get to that list? Oh, you know what? Hold on. That list is going to be, oh, I got to move the Google people. Okay, so that one is, I think, is that one in here? Nope, hold on. I went to the wrong slide. Alzheimer's in the brain, Alzheimer's and dementia. Hold on. We are skipping through real quick for those joining on the different types of dementia. It's got to be here in the brain. Let's see. And then we go. Did I skip it? And we heard from our expert.
Dementia.
Here we go. It's got to be on this one. No? Well, clearly it doesn't let me pull it up. So unfortunately not, but you will get copies of the slides. Oh, wait, no. Yeah, you will get a copy of the slides. So unfortunately we can't pull it up, but you will get a copy of that. Yeah. Any other questions? Okay, I don't see any questions on the chat. So what we're going to do is we're going to bring the IT gentleman back up and we're going to switch over to the next slide. We have to download that. I'm assuming everybody that's online can be staying for the whole thing. Right? Okay.
Are we gonna get another paper? No, I'm just gonna get the credit for all three. But the evaluation we just did is for all three or just the first one?
Okay, you gotta go back to, it's in that same link. We're just gonna go to a different folder. Because I have all of them in a Google folder. So we need to go back to the one that we downloaded. So in Nancy's email. What's is effective communication strategies next? That one you can easily download. Well, we're gonna need that link one more time for the next one. Sure. Perfect. That's it. Okay. Right. Oh, we're recording for it, right? Yep, that's still. Okay, perfect. Okay, we're still recording. Here we go. Okay, so welcome back again for those on. And remember, on the evaluations, we want all fives because that's, just how we're gonna roll. I don't know if it's out of 5. If it's out of 10, then don't listen to what I just said. Okay, effective communication strategy. So in this particular program, we're gonna go over a variety of things, from explaining again the changes that are happening, but also how do we decode what is happening and how do we respond in ways that, again, is going to be helpful for the person, but also for those of you on the call and those in the room, how many of you have worked with somebody with dementia and you have left so stressed that you are just like, oh my gosh. Well, we're going to go over ways that, again, you're going to reduce that stress as a caregiver yourself. And then we're going to, again, talk about strategies. All right. So first of all, what is communication? We got all this stuff on here. I mean, it's amazing what can happen from you just got out of dealing with somebody that didn't want to take their pills. So you walk in the room and you are angry. My aunt is in this boat where my aunt is in the mimic phases, where if my mom, raises her voice on the phone because she's mad at customer service, my aunt will start crying because my aunt's not getting yelled at, but she's in the other room and she assumes that my mom is yelling because of her. And so again, these are things we need to remember, from body language to how our tone of voice is when we're working with somebody with dementia. It's going to set them off. Also remember that what they had seen prior may have set them off. So these are things, there's a lot going on that we need to really look at when we're working with somebody with Alzheimer's. So as we said, and this is again with dementia as well. So as we said, we got the early, middle, and late stage. So in the early stage, again, they're able to easily convey their thoughts and their feelings to us, which is why if somebody is recently diagnosed with this disease and they're in the early to middle stages, there's some things that I highly stress that you tell their caregivers, and you even tell the person living with the disease, is remember remember all of our senses: sight, sound, smell, right? Tell them to have their loved one, and if you're talking to the person with the disease, then tell them directly to create a list of loves and hates. I love the smell of grass. I hate the smell of pine. This way, as they progress through the disease, if it's Christmas time and you're going over to your daughter's house and your daughter always has pine scented candles and pine plugins, you tell her in advance 2 days before, don't light a candle, don't plug that in, because it's going to set your father off. It's going to set your mother off. Have them be, if they're in this stage, help with their early communication as they progress and are able to tell what they want. Again, the middle stage, they're going to start to use, again, basic words. And this is where it's key that you ask them, do you want me to finish your sentences for you? Because that can become frustrating for them. If they say, no, I want to be able to remember a word, or no, after like 2 minutes, then tell me. And then the late stage, again, they may respond with familiar words. So my aunt will sit and have a conversation and she'll just be like, yeah, fine. Or she'll repeat what she heard, but she won't actually be able to cognitively have her true own conversation. So some people can mask that as well. So let's start off with the early stages. So in the early stages, we're going to see, as you can see on the screen here, we're going to see that they are not going to have too many issues, but they may notice difficulty finding the right words. They may take longer to respond, as we saw in the last video. They start withdrawing from the conversations where they just don't want to be around. But they also just really struggle with decision-making or problem solving. So if they're paying bills, they may struggle with that, where they may pay bills late. They may pay bills twice. I mean, grant you, sometimes it happens where we pay a bill twice, but this is where they start to, again, have some of that difficulty. Now, we're going to, sorry, the new ones I forgot start the video automatically. So we're now going to watch a quick video of a caregiver talking about a loved one in the early stages of the disease. And this one actually is Martha Tierney, who's one of our staff members. So let's go ahead and listen to Martha.
Communicating in the early stages of dementia with the person with the disease is important. At that time, you still have language as a tool. So you can learn things about what they might prefer as the disease progresses. For example, as the disease progresses, a person might have difficulty finding words. Caregivers often struggle to know what to do in that moment. Early on in the disease, you can ask. You can say, you know, if you ever have trouble coming up with a word, would you rather that I jump in and give you the word, or do you want me to wait and allow you some time so you can find it on your own?
And that's again key, is giving them the path in their care. Let them decide what they would like. Because remember, no matter where they are in this disease, they're still in there somewhere as the person. And as they progress, we tend to forget that. We tend to talk about them, or their loved ones talk about them right outside the door where they can hear. We really need to remember that if we're having conversations with the caregiver, or if they're in the middle to late stages, to walk away because they still can hear. So we want to make sure that they're part of the conversation if they have to be, or they're part of the conversation you know, that you want to have. And if there's one you don't want to have, just again, go to a separate room where they're not around. Again, communication to connect with the person, ask them directly. Keep your sentences straight and to the point. Leave plenty of time for conversations, because again, what may take a 2-minute conversation with one person, with somebody with dementia, may take 4 or 5 minutes to have that conversation. And in fact, I have some cards here for those in the room, if you'd like to take them, that actually you can give to the caregiver to keep in their wallet. So when you go to a restaurant or you go to the grocery store, you can slip it to the person. It says, "The person I am with has dementia. They may need a moment to respond." This way they can keep their sense of self and the person is aware of what's going on. So I do have those if any of you would like them, but also include the person in the conversation if they're still able to be. And if they're not, again, as I mentioned, just have that conversation a little further away, because they can still hear and you don't know where they are. One moment they may be lucid all of a sudden and then they're not. So you always just want to remember, keep their dignity. All right, so keep in mind, avoid making assumptions. This is big. Speak directly to the person in the early stages. And again, communicate in a way that's most comfortable for them. So if they prefer the phone, talk to them on the phone. If they prefer email, talk to them via email. I know in the case of my uncle, again, he doesn't have dementia, but my uncle's one of those ones that's like me. It's like, no, we want to talk to you on the phone. We don't want to have a text message conversation. Text should be just a quick yes or no. Do you want this, or what do you need? But if it's a conversation, don't have it via text. Give us a call. That's how we like it. And if the person likes it, and remember, age is the greatest risk factor. So most of our people with dementia are going to be in their 60s. They don't text, they don't email. They prefer that conversation to be had one-on-one or via phone. But laugh together, you know. I can mention this because this actually happened on one of my CGH programs I did. And we were talking about, you know, sights and smells and sounds they love. And believe it or not, one of the person is in the late stages, but when they go to visit them in the nursing home, and we all had a good laugh about this, they bring a paper bag, and the nurses now know what's in that paper bag, and they don't even question it anymore because it's a bag of manure. He loves the smell of manure. And so if that's what they love, bring it in, let them smell it, let them feel like they're back on the farm. So these are things, again, that laughter is good. Have some good laughs, share those memories. And again, be honest and stay connected with the person. Now, oh, I didn't realize this thing's blocking your guys' view. My fault. Well, anyways, okay, there we go. Now, communication in the middle stages, as you can see, this is where we're going to start getting a little bit more difficult. And so one thing I want to stress, once they're in the middle stage, is you must, with a big M, oh, yeah, M-O-S-T. No, M-U-S-T. Geez, it's most and must. You must join their reality. Do not fight them. Because I will tell you, when I drove into Whiteside County today, I could not believe how pink your guys' grass is outside. You guys have the pinkest grass. Now, we have somebody in the room that just gave the look I was looking for. She gave me the look of like, what are you talking about? We got pink grass. Isn't that grass beautiful out there in pink? You know it's not pink. You know it's not pink, and I know it's not pink. But to them, it's pink. That's a beautiful shade of pink. Because remember, you can argue with them all you want and say, the grass is green. They're going to get frustrated because you just corrected them. Now you're frustrated, but guess what just happened within 3 minutes? They're on something else and they forgot all about that argument. But now you are holding it with you all day. And I got somebody in the room, for those that is giving the look down like, oh my gosh, that is so right. Join their reality. When we're in the middle to late stage, join the reality. What is it going to hurt if you're talking about that, you know, President Clinton is still the president? Oh yeah, no, President Clinton's doing great. It doesn't matter. Join the reality of where they are.
It's a lot like, I used to work in childcare. It's a lot like playing into their reality.
Yep.
Their play.
Yep. And that's what you have to do, because again, you want to keep their dignity. You don't know where they are, because as this disease progresses, they're going to revert back more to the long-term memory. So their mom and dad are alive. They're in their high school years. You need to join the reality of where they are. Now, in again, the middle stages, they are going to have increased difficulty finding those right words. So immediately we want to correct and say, oh, you mean you want the plate? You know, give them time. Remember, think in your head, okay, let's count, let's give them time. They need to respond. Use familiar words and repeat them. Again, inventing new words is going to happen to them for things that are familiar. So if they say, give me that round thing, be like, oh, here you go, here's your food. Don't correct them and say this was a plate, because now they're going to feel that they were talked down to. Just say, yep, here you go, here's your food. You know, remember, it takes us time to remember to not correct them and not say, this is the big one, I just said that. Don't you remember? Because it's not that they don't want to remember, they just don't remember. So again, they easily lose their train of thought. They're going to start speaking less frequently. And then again, they're going to start communicating through their behavior more than words. And if you again start to see any of these even further, and you know the person doesn't have dementia or hasn't been diagnosed, again, consult with the doctor.
I would advise couples, and I usually do advise the caregiver who comes to the group and is caring for a spouse, that you take your time. Always count to 3 before you respond, because it gives you time to think about your answer and what's going on. Generally, in a marital dispute, it's quick. It's back and forth. You're quick to give an answer. When they've been diagnosed, to sit back and say, okay, you're supposed to be the one that's reasonable here. Let's change how we do this, because there's only one thing you can control, and that's you. You cannot control them and their process.
All right. What if the reality is their spouse is cheating and they are not? Aha. So great question. So this is where things like this appear, and I was going to talk about it as we continue to progress here, but that's a great question. So when you are working with somebody with Alzheimer's and dementia, remember in your responses to not correct them. So if they say something, we of course want to admit it. So the 2 words I want you to remember is yes and. Yes, that's a great question. Or in this case, yeah, I guess they could be cheating, or yeah, maybe let's investigate and join that reality. Because again, saying no, they're not is going to again get them to fight. So in this case, you want to say, that's a great point. We might want to look into this. It doesn't always have to be the word yes, but reassure what they're talking about. So in this case, the cheating, say, yeah, I'd be concerned about that too. Let's see what we can do. Let's see, what do you think? And again, within a few minutes, they're going to get off that tangent. So again, responding more with the positive yeses, and then reassuring you're listening, but then working a way to find out and kind of change that perspective. Because in this case, again, each one's going to be different. But, you know, if you can work them into say, yeah, I wonder too, you know, what makes you think that? And allow them to answer and say, I'm going to look into that for you. And by you saying that, they're going to think you're going to look into it. Are you going to look into it? No, because you know they're not cheating. But the thing is, it just reaffirms that for them. So again, when you're talking to somebody, you want to connect with them, approach them gently. So anybody coming in with that you're walking into a room with dementia, Alzheimer's, again, walk in and introduce yourself and say, hey, John, you know, it's Nurse Joy coming in today. How are we doing? And again, talk softly, see their eye level, introduce yourself each time. And again, don't correct them. Great, beautiful shade of pink out there. Yeah, you're right. And again, pay attention to your tone when you're working with them, and then take your time. Because again, as nurses, I know that you guys have difficulty with this. And I'm going to skip the next video because it's a longer one, but basically is sharing the same story I did of, you know, when somebody says something, you say, I just said that, and they say, no, you didn't. And then they get mad at you when you just had this conversation. Just again, they forget, you're going to have to repeat things. It happens. Okay, again, join the person's reality. So again, keep respect and empathy in mind as we're working with them. So assess the person's needs. Let the person know again that you're hearing them. That's why the yes and is so big. Be like, yeah, you're right. I mean, how many of you have ever had clients come in and again, sundowners is now taking into effect and they tell you somebody's outside the window and they're on the 3rd floor. Somebody's outside the window and they won't go away. Well, because again, remember, as sundowners takes effect, if any of you ever seen the advertisements where there's a senior in front of a window or a mirror, and you see them behind the mirror, but the person in the mirror is like a 20-year-old nurse, but they're in their 70s. That's how they truly see themselves right now. So when they see their real reflection in a mirror or their real reflection in a window, they think it's somebody else trying to break in. They think it's somebody else watching them, which is why you want to say to them, yeah, I'd be concerned about that too. Let me go check for you. And then while you check, slowly close the blinds and be like, I'm looking. Oh, they ran away. And then close the blinds. 2 minutes later, they forgot because you pulled that reflection away. So again, join the reality, respond with the yes ands. So you reassure what they're talking about, but then you move on. And then again, respond to the emotion, not the statement. So again, they're just a little upset. Be like, yeah, I'd be nervous too. I'd be scared right now too. But you know what? I called security. They're on it. It's going to reassure again that emotion. Okay. Also in the middle stage, let's keep it slow and basic. So use short sentences, limit the distractions, and again, be patient as possible. And then again, if they like, then after a minute or two passes, offer them and say, oh, did you want the plate? And then let them know that. Also, this is something I can't stress enough. When it comes to, do you guys give your patients a choice of food to come up? You know, do you give them the option, say, would you like this or this today? You do? Okay. So if you know, let's say their options are turkey or ham, and you know your patient loves turkey. In the middle stages of this disease, you want to say, oh, hey, John, did you want ham or turkey for lunch? Put the second option as the option you know they are most likely to pick, because they will remember the last thing you said, not the first thing. They might surprise you, like my aunt did when I gave her 2 options and she chose chocolate ice cream instead of vanilla. So she threw me for a loop. But the thing is, if you know they like it, put the second thing last, and that's what they're going to respond. So when you say, do you want an oatmeal or eggs? If you know eggs is what they're going to eat, they're going to probably choose eggs just because that's the only thing that they tend to remember in the middle to late stages. Okay. Also give multiple cues, so you can use visual cues and gestures. Avoid sudden movements if you know you're coming into a room. Write things down for the person. So you know if they keep asking you constantly, when's my sister or when's my daughter coming to visit? How many of you get that where they're asking when are someone's coming to visit? I haven't seen so and so. You know, you can use a calendar and say, oh, let's look, and then have something circled, you know, so that they stop asking and then they can hold it. So use those. Repeat as needed, and then also turn the negatives into positives. So as we heard there, reassure the yes and then avoid quizzing them, saying, you know, you can do this. You did this yesterday. Again, try to avoid you did this yesterday because they don't probably remember yesterday. All right. Also, we want to respond empathetically and again, reassure. So join the person's reality as much as you can. Now, this is a story I do like to share here because I had this came up last year, and I had somebody ask me what they should do because their mother was reverting to her teenage years. And she got to the point where she started to take her clothes off and seduce her grandson. And she's like, I just don't know what to do, Joe. And this is where joining their reality comes into play. So I asked the woman, I said, okay, as part of the therapeutic fib, I said, is her mom and dad around at this point? And she says, yeah, mama and papa are alive. And I said, okay. I said, well, let's join the reality and let's try this. Next time she does that, I said, remember back in the early 1900s when her parents would be alive, they would have feared one parent and revered the other. And she says, yeah, she feared papa because of the belt, but she loved mama. And I said, okay, next time that happens, I want you to stomp on the ground and I want you to say, oh, I think papa's coming with the belt. After doing that, she never took her clothes off again. And so again, join the person's reality. It makes us have to really think, how do we communicate with this person? But sometimes we're going to have to do that. And again, this helps with, again, validating and then redirecting that person to the behavior we want. Now, again, are you all going to get that situation? No, but it's a good example to show. All right. So again, some changes in the late stages that you're going to see. Communication is basically reduced to a few words or just some sounds. Also, we have to remember responses, possible responses to familiar words or phrases or smells, like the cow manure. These are things that you want to start to utilize to make your communication. So if you know your patient in the late stages, loves the smell of lavender, well, next time you go in to reassure them if they're a little anxious, go get a lavender lotion and put it on their hands and rub their hands and put the lotion on. They're going to get the smell of the lavender. The touch is going to help calm them. These are ways that we can work with them and communicate with them. So to connect again, listen to expressions, especially in this case, in the middle to late stages. They may start to tell you some things and be like, oh, my foot hurts, but really they got a cavity. So they can't really process where things are, which is why we're going to talk about that in the next one. We got to be detectives. We want to, again, help the person feel safe and happy, and continue to bring them, again, respect. So still have a conversation with them and say, oh, it's such a beautiful day out, isn't it? The air feels good. Have a conversation with them. So again, they feel they're there. And this is where, again, use the senses to communicate. So the lavender smell, the lotions, if you know that they love oranges, but right now they really can't swallow because they're in that late stage, try some orange jello. So this way they can get the orange, they can get the watermelon, but we know they're not going to choke.
I know that my mom feels aggravated. I know that she feels alone. I know that she feels confused. And I know on any given day, I don't know if I've made it better for her. I try. In these later stages, I've come to recognize that being really aware of the 5 senses is really important. Touch seems to give her a great deal of comfort. I know when I come over, I'm going to brush her hair all the time. And my husband noted to me recently, he said, you should see the look on your mom's face when you're brushing her hair. She's just happy. She's just happy. She doesn't say a lot. And I do it for a long period of time. I comb it, I braid it, I do funny things with it, but it just allows me to just be with her in a way that makes her feel comfortable.
So again, you'll find out what works for your clients. You'll find out what works for your patients, whether that is a hand rub, whether that is, in this case, just combing their hair and just having a conversation. Again, these are things that you'll pick up because each person's journey is so individualized. What may work for the patient in room 121 may not room for patient 123. So you all will have to kind of get to know your patients. But these are some things we can do with touch. Again, different fabrics. I don't know if the hospital has these kind of tools or a bag of dementia tools. Does the hospital have that here by chance? I take that as a no. So this might be something you may want to work with your hospital administrators on, is coming up with, just like how we have autism bags, making dementia bags that actually has things made of different fabrics, different shapes. If you have a group here where women love to, or even men, like to crochet, you know how women have those muffs that you put your hands in the wintertime? Well, there's actually things you can crochet, and then inside those muffs, you crochet loose pieces of felt, or loose pieces of string, put some buttons in there because it keeps them busy. So they start to twiddle and it helps have that conversation. So these are things you can do. Also, if you have the animals come in with visiting with animals, this is really big too, or just putting up for them to see, on the screen, because they pick up, like my aunt, for instance, she loves the George Lopez show, to the point that she believes she is part of the George Lopez family. And so these are things you have to remember. My mom, couldn't believe it either. And she was like, why are you crying? And it was something happened on the show, or somebody in the family died. And she says, my so-and-so died. And my mom's like, what are you talking? Then she realized it was the George Lopez show. So if you know that your patient is really in tune with the TV, maybe change it over to a YouTube channel of nothing but an aquarium. The soft sound of the water, put something happy on, take the news off, because too often we know in these rooms, there's always something going on, and that may trigger your patient to be in a worse behavior. Other things that we can do, again, with sight, we can look at photos, we can watch birds, we can paint, and then sounds, again, listen to familiar music. They're going to revert back. So, you know, as much as a Taylor Swift song may be popular today, they know nothing of Taylor Swift. They may want to listen to songs from the big swing era. So maybe put on some jazz music. So revert back to where they are in their life. And again, if they grew up in the city, you know, instead of having white noise or something, go to a YouTube channel and just type in, you know, city traffic noises and let it play so they feel that they're back in the big city. Or if there's animals from a farm, there's different things you can do. Read books to them, and again, let the person hear your voice. Smells, again, are big. Bring in these different things. There's so many oils you can put on to cotton swabs and other things that they can smell. So use fragrances as much as possible. And again, remember, as they move later in life, the thing with food is we got to move to softer foods because, again, it is harder to swallow. So make their favorite foods, their favorite goodies, maybe put those treats and those flavors again in like a clear gelatin. There's so many flavors you can do where they think they're having cake, but they're really not having cake. Flavored drinks, again, are big, and you know, ice creams and puddings are big as well. Okay. So with that being said, communication in all the diseases, to wrap up, join the person's reality to connect to them, understand and accept what you can and cannot change. Because at this point, as they move into middle to late stage, you are not going to change their behavior. If you say, okay, it's time to, you know, go for a walk, and they basically say they've already gone for a walk, use these different methods because you may not be able to get them for a walk. But, you know, use the different methods and say, oh, you know, I wonder if they keep talking about their mom, say, I wonder if Judy's at the end of the hall. Let's go check. And be surprised, you may go to get up to look for Judy, but by the time she gets out the door, she forgot all about Judy, but she's already on her walk. So again, use their reality. Always treat the person as an adult. And again, try to decode the person's communication by their different body and their sounds and what they're saying. And then again, just try to understand the source, which we're going to talk about in just a minute, of the reaction. Okay, and with that being said, again, this is just some of our helpline stuff. So now we'll move on to our last presentation, which is understanding and responding to dementia-related behaviors. So we're going to swap it out for the new download. I'm trying to make it as exciting as I can because the topic is a little boring. Oh, well, good.
I have ADHD.
Great.
Yeah.
That's
Focus, which is good.
well, you know, it's so I used to teach driver's ed, and I used to tell the parents on day one, they're like, teaching your kids, not a problem. I said, because it's a lot safer to teach your kids than what I used to do. And next one's understanding and responding. So we go back to education materials, and then we're going to do it. But I used to work actually in the zoo field. Did I do a TV? Next one. 30-minute version. But I used to work in the zoo field, and I actually was almost killed by a rhino. And so working with rhinos, scary. Working with kids, not so much. Viruses. That one should open up right away too. Yep. Perfect. Share. All right, so the last one is UARTD, which is understanding and responding to dementia-related behaviors. So I'll go ahead and give this program now. Okay, so everybody on there can hear us, and our screen is shared. Everything is good. So this is going to talk about the 5 big issues that are going to possibly come up for somebody with Alzheimer's and dementia. And so the first one that we're going to start off with is looking at the triggers that can cause the behaviors that you're probably seeing. So a lot of times we need to look at, is there pain or is there discomfort? Was there something that was overstimulated for them? So again, has the news been basically nothing but running in the room because the person next to them, really wants to watch Fox News? And on there, they just saw about, Russia or whatever. So could that be causing issues? Are they fearful of something? Did they just hear the doctor say outside, let's get them ready for surgery? And they assume, I'm going in for surgery. It wasn't meant for them, but they heard it. And then again, they're in an unfamiliar surrounding in the hospital. So this can also cause some issues. And then again, did you ask them to do a test that, be like, okay, go use the bathroom? Well, in my aunt's case, when my mom says, go take a shower, she doesn't remember what a shower really is. My mom has to walk her through every single step. So this is the stuff that you need to remember, that what is easy for us may not be easy for them. So there's 4 things you need to do. So you need to now, on top of being nurses and employees here, social workers here at the hospital, you now have to become detectives. So you got to put your detective hat on. So we need to start off by detecting and connecting. So figuring out, what's going on. So in order to detect and connect, the first thing that you always want to do is say, could this be a physical need? So is this something physical that's happening? When they, like I mentioned before, they say their foot is hurting. Well, could they actually have a cavity that's causing them pain? Is this a UTI? Which again happens more than most people would know, and as nurses you all know this, it could be a urinary tract infection. So is this a physical need we need to worry about? If it's not a physical need and we know, okay, it's, their teeth look fine, their feet aren't swollen, I don't think it really is a physical need, we then start to do the emotional need, because maybe, like in my aunt, she watched that episode, somebody died, my mom had to immediately address the emotional. It wasn't anything there. It was the emotional side of what she just saw on the TV. And then what we need to do lastly is, did that work to fix the situation? And if it did work, what do we need to do next time? So we need to readdress so that we're ready for the next time this occurs. So first of all, under detecting and connecting, again, we want to join that person's reality. I cannot stress that enough, because we need to see the world through their eyes. So if they're saying that grass is pink outside, then that is the most beautiful shade of pink you have ever seen in your entire life. I have a former volunteer of mine. I talk to her quite regularly, and she is from New York and is very, very combative and wants to prove her point. And she says, Joe, it's the New Yorker in me. And I told her, I said, Cheryl, that's a beautiful shade of pink. And she thought I was going, wacky on the phone. Now, every time she talks to her father-in-law, who also has some form of dementia, she literally says to herself in her brain, that's a beautiful shade of pink. That's a beautiful shade of pink, so that she doesn't correct him. She joins the reality and says, yep, you're right. You're absolutely right. We also need to make sure, again, that we're looking at the who, what, where, when, whys when we're doing something. So what took place before the person started to have this reaction? Were they watching something on TV? Was a doctor nearby reading a report that they overheard? What could have caused this? Did I walk in and have my arms crossed because I was cold, because their room is cold? They don't understand this means you're cold. Remember, there's things that can trigger this. So we need to be a detective of what's happening. And when we do approach the person, always approach them calmly and give them respect. So again, look at the medical issues. What's happening? Is this, did they just come out of surgery where, a couple days after surgery, they still could be sore in that spot? Look at the medical issues. Also, look at the desk and see, wait a minute, I put this water here 2 hours ago and nothing's gone. So could this behavior be because they're not actually getting their liquid in, they're thirsty? Look at the different things that could be happening. Also, has nobody really come in to speak to them for a day? I mean, you guys have tons of cases on your plate where you'd love to spend an hour with each of your patients. but you just can't because you have too many. So has nobody really come in to even check on them? So could that be a factor? Or if they're at home, nobody checked on them. And then again, looking at the environmental triggers. If it's cold for you, is the room too cold for them? Or is it too hot for them? Because this is also something that could be affecting them. So we need to really address all this physical needs if a behavior is starting to come that could be taking place. Then again, as we said, we're going to focus on the emotional needs. So see, was it something that happened in what they were watching? Or, you know, is this something that they're reliving a situation? So to share a story, my mom called me and said, Joe, your aunt started to do something she's never done before, and it freaked me out. And my aunt, unfortunately, we did not know as a family for years. She was actually in a physically abusive relationship. And she's at the point where this week she saw her ex-husband in the room and said, he's going to beat me. And so in that case, we moved immediately to the emotional needs and says, oh, Sandy, you're right. You know, we're going to get Rick out of here. And they did. They pretended to walk him out, and that calmed my aunt down because in her reality, that's what she was fearful of. And so again, are you going to have a situation like that? You may or may not. But remember, you know, they'll start to revert, and we need to really address what's happening on the emotional side. Also, again, use what we talk about here with effective interventions. Again, if it means walking somebody out of the room who's really not there, walk it out. What does it matter if you're pretending to put your arm around somebody to walk them out? Join that reality. And then again, redirect the energy into something more soothing. So right afterwards, say, oh, that was tough. You know, let's go ahead and let's get some lotion on our hands, or let's go ahead and let's go for a walk and walk it off. Again, just redirect, always redirect. All right, so now we're going to watch about Rose, because this is something that Rose is going to talk about with folding towels, and how some people will say, well, that's belittling of them if they're folding towels. Well, remember this, how many of you on the screen, or even those in the room, you know, your mother was a stay-at-home mom, and that really was her job. So remember, in this case with Rose, Rose is actually one of our volunteers, but her mom was a stay-at-home mom. So folding towels is what she remembers from 20, 30 years ago. So to some people, refolding the same towels may seem pointless, but it brought her mom joy. So I'm going to play this quick video.
She was part of the family, you know, she'd fold towels, and she'd fold towels all day long some days. Just, you know, put them back in the basket, and then she'd give them to her, here's some more towels. And it may sound like it's cruel, but look, it kept her busy. It kept her movements going. It kept her, you know, just kept her occupied, and it made her feel wanted and that she was contributing. We created a routine for her that worked for her around her agitation and, you know, her sleep patterns. So every day she was in the same routine for the most part, and every day she did something. She was always in the kitchen every day helping do something. Sometimes she'd rinse dishes, but she was always near the kitchen sink because she spent most of her life in front of the kitchen sink. Now she was just doing it in different ways. And yeah, going for a walk, going out in the car for a drive, walking around the yard, you know, watering plants. Those are all things that she did, and we just had her continue doing them.
Yeah, so again, bringing them some type of meaning and purpose is going to be big. So again, if you know in the hospital, and this is a great example, you have some flowers here that do need to get watered that are on the floor, you know, again, tell the nurse, hey, don't water the plant on the desk today. Judy, you know, really loves to water, and have Judy come with a little cup of water and pour it in the pot. You know, those little things really are going to bring a big purpose to them. And again, it's really going to help. And in this case, it helped her mom really well. I know in my aunt's case, you know, they will do activities with my aunt where, you know, she used to do production. So they'll give her other tools to start to do. They have a box of fidget tools where she puts stuff in and then seals the box, and they re-undo the box, because that's what she did as a living. So again, each person's going to be different, but go back to their reality. Now, if that doesn't work though, let's reassess and plan for the next time. So if you're like, okay, It clearly was not the temperature in the room. We lowered it. Now they were too hot. Make sure the other nurses know. So again, write down what you did so others know how to react to that person, because we're always going to have to make adjustments as we continue to progress. And now the other thing is we're going to now move into the 5 major things. So confusion or suspicion. These are the big ones that will appear where they're not going to recognize family, people, familiar places and things. They're also going to accuse people of theft. How many of you have ever been accused of theft by somebody with dementia? Anybody in this room? Okay, we got one hand in the back. This does happen. So again, if they say, oh, they stole it out of my purse, again, remember the yes and be like, yeah, that's very concerning. Let me look into this. Or if they say, my family hasn't paid the bill, they need to pay the gas bill because they're going to turn my gas off. Just say, yeah, that would be bad. You know, how about I pay it for you? Join that person's reality. But these are going to come a lot, as you saw in here, infidelity, places. And I cannot stress this enough. If what you tried doesn't work and you're like, I don't know what to do, call the helpline. They're there to help you, even as nurses and social workers, to say, have you tried ABC yet? Because they will guide you on some ways to try, because we have to use what we call therapeutic fibs and join the reality and what's happening. So suspicion is going to come up quite a bit, where at some point they're going to accuse you of something, or they're going to say something happened because, again, of where they are. So remember that this happens quite often, and we're going to have to repeat things quite often. So we're going to skip and situation. So aggression, because I got 10 minutes. So aggression is another one that does appear. It doesn't happen that often, but it can happen. So a couple things that I want to stress with aggression. Aggression can happen if they just saw something negative on TV. Aggression can happen if they, the loved one is in there and not paying attention, because I mean, how many times do patients talk to you and you don't realize patients are talking to you because you're so focused on what you're doing with making sure the meds are right for the next patient? It's not that you do it purposely, but that can lead to aggression. So if we use the detect and connect and find out, oh, they got mad because I didn't realize they were talking to me. These are things we need to know. And with aggression, I want to stress this. If, and you can even tell this to the caregivers, if at any point aggression gets dangerous, it is okay with a big O and K to call 911, to call security. Let them know that the person has dementia. So when they arrive to help, they realize talking to them, saying, what's wrong? What's this? May or may not work, but you need to tell the dispatcher that they have dementia so they know how to respond. Also with aggression, this again doesn't happen that often, but depending where we are, Whiteside County is going to be a little different than going to like a Cook County in Chicago. But if that family, has had guns, and in the situation that we would normally read, it does talk about how that family had guns and Anne grabbed the gun even though it wasn't loaded. Remember, you may know it's not loaded, but that police officer doesn't. So if you do have guns in the family, it is recommended at that point to really make sure either the guns are at somebody else's house or the guns are not in the house at all. Wherever you need to go to secure them, secure guns to where that loved one probably won't get to them or cannot get to them. Because again, even if they're unloaded, people don't know that. So you want to make sure that if that does happen, does it happen often? No, but just be aware of that. Okay. So again, aggressive behaviors normally are not dangerous. They just get mad at something. But if you respond with the yes and, you can bring them down from that aggression. Yeah, I'd be nervous about that too. Again, reassure that you're listening to them, and that should help bring it down. All right, repetition. How many of you have gotten this one where you walk in and your patient says, what day is it? You say, oh, it's Tuesday. How's everything going? What day is it? And then you get, so I see some smiles in here like, yeah, I'm about to go back up to that after this class. Remember and say, repeat to them, oh, it's Tuesday. Or if they say what day it is, again, just ask them, well, what day do you think it is? And then that may sidetrack them and say, oh, I don't know. And be like, it feels like a Tuesday. Does it feel like a Tuesday to you? Yeah, it's Tuesday. Again, play with it and have fun instead of just responding. It's Tuesday. It's Tuesday. It's Tuesday, because your voice is going to change every time you get more frustrated. And they're going to pick up on that. So, again, play with that. Or the other thing is say, oh, I don't know, let's check the calendar, and keep a calendar next to it if they're constantly asking. The other thing you can do, and I don't know if the hospital has them here or not, but this did help somebody that I talked to 2 weeks ago, where their loved one would take a nap and take several naps throughout the day and immediately get up and feel like they wasted 8 or 9 hours when it's really been 20 minutes. Have any of you ever had that? I see some head shaking. Maybe in this case, see if the hospital can have a couple on hand, a couple huge digital clocks that you can see the PM and AM, and it even says the date, and plug it in right in front of them. So when they wake up, say, oh, I don't know, let's check the clock. So this way, not everybody's going to need it, but that could help you guys save a lot of time, and see if the hospital might be able to have those as part of your dementia kits. All right. So these are things. And again, don't say you just asked me that, because remember, if you heard that as a kid, or you heard that now and say, didn't you just say that to me? Wouldn't you get mad? Because you've now been talked down to. So we don't want to talk down to them. All right. Last thing we're going to do is, one of the last ones is wandering. 60% of people with dementia will wander. All right. And again, it can happen without warning. Have any of you ever had a client or patient wander all of a sudden in the hospital? Oh, nobody. You all got lucky. Okay. Well, wandering, just so everybody is aware, with wandering, there are several things you can respond with. First of all, how many of you know what silver search is? No? Have any of you ever seen, when you're driving, an alert come across, say, silver search? Well, silver search is dementia and Alzheimer's. So if you ever see a silver search on the highway, that is somebody took the car that has dementia and Alzheimer's, and the county will put it out. So if you ever see silver search, just like amber alerts are for kids, silver search is dementia or Alzheimer's. So if they start wandering and they've been gone for a couple hours, call the county sheriff. They can put out a silver search alert. They know all the rules on it. Well, they should. If they don't, they can always call their dispatchers. But silver search is something. Ways that we can get around wandering it's just something that happens in the brain. You can put a dark mat in front of the door. Don't ask, it doesn't work all the time, but it does work a lot, because that dark mat to somebody with middle to late stage Alzheimer's looks like a giant hole in the ground, and they will not cross it. So you can try putting dark colors in front. You can actually put the same color piece of cloth over the door handle, and they can't find it. Because it all looks the same to them. So there's some things you can do to cut down wandering. Like in my aunt's case, she will not be able to find her way back if she goes to wander. So my mom has taken some of these techniques and does put them in front of the door so that she doesn't leave. And when they're ready to go somewhere, she removes the mat. That's why if you're walking your patients and you're going up and down a hallway that may be white tiles, and all of a sudden you have artistic, really dark tiles, they may all of a sudden step to the right or step to the left, or a dark color rug throws them off. That's why, because their brain is processing it as there's a hole right there, and they won't go that way. So keep that in mind. Have any of you ever noticed that with any of your patients? Well, you will now. Now you're going to be like, oh, look, they just did that. Okay. Lastly, again, is our resources. I got 3 minutes, but again, these are some of the resources that we, again, cannot stress enough. And I do want to make a quick mention to care consultations, which of course are not on here because this is an older one. But if any of you know caregivers that come in that their loved one is diagnosed with a dementia of any kind, please see Nancy, see Joan for the care and support cards that the hospital has, because they can call the helpline and say, I was told to call and ask for a care consultation. They can get this every single year, free of charge, no insurance needed. When they call, they will immediately be transferred to a master level clinician, where they will spend 35 to 45 minutes with them on the phone, and they are going to ask them specific questions about that diagnosis. Then they're going to be emailed a full report that they can share with the doctor. They can share with the other people within the care plan, so family, friends, whoever. It's going to tell them what behaviors might come this year and how do you respond. What questions to ask the doctor next time you see the doctor about certain meds that might be an option. what to talk to a financial advisor on, what are things to be ready for in this next year based on what we know of that diagnosis. And it's all free, cost nothing. Families too often find out about it too late and they wish they would have had it, and it's going to help tremendously. But it's all free. All they got to do is call the helpline and say, I want a care consultation, and they will get that immediately sent over to them, all free of charge. With that being said, we got 2 minutes. I'll take any questions about anything we talked about, but you guys got the nitty gritty in an hour and a half, 3 programs. I did it as best I could and as quick as I could, but we do have other classes that you can always take online. If you want to learn more about the disease or learn more about, different studies out there. But I will take any questions in the chat or from the room.
You talked about risk factors and you mentioned, genetics and obesity. What else?
So, okay, so there are different risk factors that we know of. So the association is hoping by 2025 to really pinpoint even more risk factors that we know that we can change, to have the potential to, have risk reduction. So in the latest studies that came out in Denver last year, they discovered air pollution also plays into effect with increasing the risk of Alzheimer's. We know that excessive alcohol can increase the risk of, and drug use can increase the risk of Alzheimer's disease. And when they say excessive alcohol, it's quite interesting because this is all based off of like the Lancet study. And this is something that I heard one of the neurologists speak about. So I'm going to ask the room real quick. How many glasses is technically considered safe of any alcohol for a woman to drink? What do you think?
2 or 3.
We got someone saying 2 or 3. Okay. What about a man? Okay. What about a man a day? How many a day can a man drink safely?
Twice as many as a woman's safety.
Okay, twice as many. So here's the thing. Technically, the answer is 0. 0. There should be 0 alcohol. But if you are to have alcohol, the Lancet study discovered that you can have one glass if you're a woman, 2 glasses if you're a man. But here's the thing. How many ounces in a glass? Doesn't matter the alcohol. How many ounces?
And how often?
Okay, we got 68 ounces, a little too much. Okay. But you're not going to need that after learning all this today. All right. So normally it's 8 ounces, right, in a glass.
Not enough.
But here's the thing. The Lancet study, women no more than 4, men no more than 8.
Ounces?
How many ounces are in a can of beer? Technically, a guy drinking 1 can of beer is technically excessive. You drink more than technically what's truly safe. Based off the Lancet study, if you drink it every single day, we're not talking like maybe 1 a week or something. I don't drink at all, so I don't really know any of this stuff on the alcohol, but I thought that was amazing because think about it. When you fill up your wine glass, do you truly fill up the 4 ounces or are you like, and then take a full glass that's really probably 3 times the servings of what you should have had. So that's why, again, there's different risk factors. Again, we don't know 100% what causes this disease, but we know certain things that can lead to it. So that's why like veterans are at an increased risk because think about the head injuries they go through or the chemicals. So there's so many different factors out there. That's why each person's journey is so different on what they did. And like I gave a class, a healthy living class, and I had a 94-year-old woman say to me, what good does this do me? I'm 94 years old. And I said, do you have any grandkids? She says, yeah. I said, do you have any great grandkids? And she says, well, of course. And I said, well, how old are they? And she says, well, 1 is 4 and 1 is 8. And I said, do they ride bikes? And she says, well played, young man. I'm going to stay. Because we were just talking about wearing helmets when you're doing activities and protecting your head, because we know head injury increases that risk. And so even if it may not help you, it could help your grandkids. It could help your nieces and nephew. And that's why our goal is hopefully by 2025 to really have more of these pinpointed on additional risk reductions. But again, we don't know still 100%, but there are different factors out there that increase it. Just like anesthesia. If you ever have somebody who has dementia or Alzheimer's and they just went through surgery and all of a sudden after surgery, they really are not what they were before surgery. We don't know exactly why 100%. I can't answer that because I'm not a doctor, but anesthesia has been known to, increase the effects that Alzheimer's has on the brain. So again, there's certain things, and that's why there's so much that we recommend to go to our website to learn more about, Alzheimer's, to do research, because this is just an amazing thing that we got to break that stereotype. We need people to talk about it, to understand it. And my big thing that I always talk about is to tell people to stop making jokes saying it's sometimers or old timers, because this disease is a terrible disease and you don't know who in the room lost someone, is caring for someone, that it really could put a hurt on them. Just like my mom said, this is worse than caring for my two grandmothers that died of stage 4 cancer. She says, this is a lot worse. And so that's why we want to be more mindful of what the disease is. Any other questions? No? If not, Nancy, I'll give it back to you. Oh, well, since there's some people still on the call, I figured I'd give that to you.
Maybe how to get the presentation, or
What's that?
how to get the video recording or the presentation.
Yeah, and we'll work on, I'll send an email out on how to get the video recording of this. Also, we've have CEs, a CE available.
Make sure you're using some microphones up there.
Okay. Thanks. So do you not hear me? Okay, so we will work on getting the video recording out there. Also, we have CEs available. It's actually one CE. So if you're interested in that, and if you would, I know I could see phone numbers out there, so I'm not exactly sure who all was viewing this. So if you could let me know that you viewed this, I'd appreciate it. Any other questions?
I guess we answered them.
Okay.
And for those in the room, these are older magazines, but it does talk about like cannabis and stuff in it. But in here is a card, and you can actually sign up to receive this yourself for free. It comes out once
Have a great
quarter.
day.
Or talk to your nurse,
Stop share.
the head of your nursing or the head of your programs, because CGH Hospital can actually, on this website, there's a section that says, do you want to be a distributor? Like I just talked to a whole bunch of churches today that are signing up. That's also free. Doesn't cost you anything, no shipping. They can sign up to receive 100 up to 1,000 of these sent to you a quarter. So you can get